नमस्कार दोस्तों, गुड मॉर्निंग। वेडनेसडे इंस्पिरेशन में आप सबका स्वागत है। एवरी वेडनेसडे वी नो दैट वी कम अप विद अ गेस्ट हु इज रियली इंस्पायरिंग, और हर वेडनेसडे हम लोगों के पास एक नई कहानी होती है नए गेस्ट से सुनने के लिए, उनकी दिलचस्प कहानी, उनके काम की कहानी। सो इन टुडेज वेडनेसडे इंस्पिरेशन आई वुड लाइक टू invite Dr. Damayanti Thapa. Welcome, Doctor, on Akanksha Desire for Wellness and on Wednesday Inspiration. Namaste. And yeah, just a brief introduction of Dr. Damayanti Thapa. She is the founder of Neev, and she's trained as occupational therapist with 23 years of experience in working with children with developmental disabilities. Her areas of expertise include pediatric school-based intervention, autism, developmental disabilities, handwriting intervention strategies, and many more. I mean, there are a lot of things to talk about. Dr. Damayanti, welcome, Damayanti. And
Thank you.
when we talk about this topic earlier also, we had another guest who had come on the show for Wednesday Inspiration, and we had discussed, few points related to the same topic. But I would like to ask you one question. My first question would be, what exactly is occupational therapy? Because a lot of people, they do not know what it is. So if you can, explain it in a way that a layman also understands what it is, it would be really great. Yeah.
Yes. So, if I can just define occupational therapy in simple terms, it is an evidence-based therapy which is deeply rooted in science. And as an occupational therapist, we work with people across all the lifespan. So, right from neonates, newborns, children, up till
Okay.
adulthood. So, we
Okay.
work in the areas of developing their skills, so promoting their health uh,
Okay.
within their limitations. Yeah, we help in identifying the barriers which are formed due to their disabilities or difficulties that they are facing. We provide intervention strategies so that they overcome these difficulties, which are
Okay.
majorly affecting their daily activities. So, as an
Okay.
adult, what are the daily activities? Like when I wake up, I manage myself, I manage the house. If I'm employed, my work is my occupation. So we work
Yes.
on the occupation of the client or people.
Yeah.
So when it comes to
Okay.
children, what is their occupation? Their major occupation is interacting with the environment of play. Or in the
Okay.
school, it's basically related to academics and non-academic skills. So as an occupational therapist, we will promote health, develop skills, maintain
Uh-huh.
skills, or help in regaining or recovery of the skills lost due to the difficulty. The second
Okay.
most area which we focus on, as an occupational therapist, is not only working with the individual, but also we work in providing adaptations or modifications to the environment to suit
Okay.
the limitations of the client. So, for
Okay.
example, if I am an adult, like post stroke or whatever, I'm on a wheelchair. So, as an occupational therapist, how can I modify the environment so that I am accessible and functionally independent to do my
Okay.
daily tasks on the wheelchair? So, what should be the width
Okay.
of the door? What should be the height of the door? Where there should be ramps? How can I eliminate barriers? What should be the height of my bed, my table, and so on.
Okay.
So
Okay.
these are the other areas as an occupational therapist that we very predominantly work in providing adaptations as well as assistive devices or splintages to the clients. So
Okay.
that's how occupational therapist is. So it provides like
Okay.
it's an holistic approach or holistic
Yes.
perspective to your client.
Okay. Okay. So we have also heard about pediatric occupational therapist. So what do they do? Like, what is their role? Yeah.
So as a pediatric occupational therapist, we are basically trained in OT and then providing occupational therapy for children. Okay.
Okay.
So pediatric would be like from the age of say 0 to 2 and onwards. Yeah. Providing occupational therapy in school setups or home
Okay.
or special school setups or at private centers. So as a pediatric occupational therapist, my aim would be to work on the skills or the age appropriate development of the skills for the child, at the same time to work on the areas like the motor skills, the fine motor skills, your visual motor skills, working eye and hand or the motor movement together, my coordination using both hands together, my visual perception, and major other area would be my sensory processing skills. So how I interact with the environment using my different senses. How do I use all my senses together to have an appropriate behavior response? Other would be handwriting. Of course, this is one of the forte that we work on, and working on the attention skills, working on play, appropriate play, as well as social skills for the child. So
Okay.
we work with children with either developmental disabilities or with varied difficulties. So they can have neurodevelopmental difficulties, it can be autism spectrum disorders, can be hyperactive disorders, attention deficit hyperactive disorder, or attention deficit disorder, or any other developmental, even neuromuscular disorders for that matter.
Okay.
So that's how in pediatric occupational therapies we work on child-focused therapy.
Okay. Okay. So, who is benefited from the occupational therapy? Like occupational therapy is for adults as well as kids, right?
Yes. So
Yeah.
yes,
Then
yes.
who is more benefited out of this? Yeah.
So it depends. Like as I said, it works across the lifespan, right? So for a child, of course, if they are facing any difficulties or they are stuck, they are not being able to achieve their potential
Mm-hmm.
because of the areas of concerns. So is attention the area of concern? Is sitting tolerance the area of concern? Is having weak muscles or low tone that we say, or handwriting difficulty that is the area of concern, or is it that's for the children, right? And for adults, it can be post and acquired disorder. Yeah, so it can be
Okay.
post any neurological stroke, or it can be post any surgical intervention, that when their functional abilities are limited, so they aren't able to
Okay.
do their daily routine
Okay.
to the maximum potential. So that's where
Okay.
we so we have even have a like pediatric occupational therapists. We also have geriatric occupational therapists where we work
Okay.
with age
Seniors.
beyond,
Yeah.
yes, senior
Okay.
citizens too.
Okay.
I work
Okay.
with children, so for the past 23 years, I have been completely and holistically working only with children with various difficulties and disabilities.
Okay. So since you are working with children, okay, so you have worked in schools, you have got so much of experience also. So what, I mean, can you just tell us the role of occupational therapist in school setup? Just in school setup, what is their role? Yeah.
Yeah. See, I've been blessed and privileged to have seen the working as an occupational therapist in a special school, working as an occupational therapist in our mainstream school, as well as an independent private practitioner. So have this rich experience, of course. So as a pediatric occupational therapist, which is school-based occupational therapist, like you work in maximizing or uh, helping the child achieve its highest potential. Yeah.
Okay.
So it would be like, of course, for the academic and non-academic tasks. So it can be like when child is expected, to sit in a particular posture in the classroom, right?
Hmm.
So uh,
Hmm.
you help as a pediatric occupational therapist. School-based intervention will be working on those skills or areas of concerns which the child is facing in the school, where the child is in the school. Yeah. So
Okay.
we are trained in activity analysis. So when the parents give us a concern, like one part of our intervention would be like even getting the inputs from the school, like what are the areas of concerns, and based on that, try to bridge the gap from between what the child can do and what the child needs
Okay.
to do. So as an occupational therapist, we are mediators to help the child bridge that gap, to help the
Okay.
child achieve its maximum potential, as well as provide different assistive devices or strategies which can help to the child to be present, be in that inclusive setup with an external change in the environment. So it can
Okay.
be like, where the child is sitting. So you can look at the seating, in the classroom, the way the instructions are given in the classroom, how well
Hmm.
you, as an occupational therapist, we also prepare if the child is having difficulty of transitioning from one class to another class, or even
Hmm.
transitioning from senior KG to standard one or primary to secondary. These are the important stages, developmental
Okay.
stages of child's life. And
Hmm.
as an occupational therapist, you can work in preparing the child with the necessary skill set
Yeah.
and go step by step along with it. And it's a complete holistic approach. I personally believe that you can't work in one room and get the changes. So the
Right.
team is very important. So even
Hmm.
the doctors are very important, the pediatricians are very important, the developmental pediatricians are very important, the neurologists are very important, your class teacher, your caregivers, your parents, everybody works as a team. And the
Hmm.
second part would be like, as a pediatric occupational therapist, would be how creative you are with your therapy sessions, and your home program matters, because
Hmm.
after all, whatever skills we are going to develop, they have to be integrated into the into their regular routine, right? If I make it as
Hmm.
an exercise or if I make it as a task, it is very boring. So when
Yes.
I make it into a play, or when I
Hmm.
make it to look as if you just transition into the task, like you don't have to always be very mechanical about certain things. If you are very creative, include play in the right way, you see the changes which are necessary. It's very, very important to connect with a child, very important.
Yeah. So there's a very nice thing which is there on the chat box. Krishnaveni is saying that getting attention span is definitely tough, especially in these times of online. So what is your take on this?
Yeah, we all are facing this challenging situation with the neurotypical children as well as the children with difficulties, right? Like, what are the major, like, as an occupational therapist, I would say is like work on the areas like, what is your attention span for your child, right? Whether it's two
Yeah.
minutes, 3 minutes, 4 minutes, 5 minutes, yeah. What is expected in an online session is that you are expected to sit, look at the screen. You just
Yeah.
analyze, go step by step, and find out which exact area is the area of concern. So do I need to prepare my child before the online sessions with certain set of arousing activity or relaxing activity, yeah, where I need to work, maybe doing simple motor movements can help me to get into my sensory body, right? Maybe 10 jumping jacks, or maybe crawling tasks,
Yeah.
yeah, or pushing and pulling activity, right? Or even when I'm sitting, I have something to fidget with between my hands, and then look at the screen. So whatever is the cause which is taking me away from the task which is happening on the screen, I will be working on that. And the preparation is very, very important. So you really need to identify, what are the, as we say, the culprit areas, and then work on them. You have to layer on them.
Yeah.
If you're
Okay.
still struggling, of course, you need to consult an occupational therapist.
Okay. So in the chat, Janice is saying very well, Dr. Damayanti walking with our son for a change of surroundings. So, and Vedashri, knowing for her years, I'm so proud to be associated with her. She's an excellent occupational therapist and connects easily with children. Keep doing good
Thank you.
work and you can reach the sky. Oh, so sweet. Okay.
Thank
So,
you so much.
I have a question on handwriting intervention strategies. I mean,
Yes.
because this is something really interesting, and especially even I have worked in school with small
Hmm.
kids, so where I still remember there was a child, in first standard, so say
Hmm.
6 years of age. Now this boy was, very different from the others. Behavior wise, everything is good. But the thing is, when it comes to writing, he can speak also. But
Hmm.
when it comes to writing, writing was a big kind of task for the teachers and parents to make him write. He used to write very slowly and without interest. So is it somewhere related to handwriting intervention, or that is something a very different kind of thing which I have seen? Can we relate these two?
Sure. See,
Yeah,
as I said, like, handwriting, difficulty with handwriting is the outer layer, right?
yeah.
Now we need to
Okay.
dig deeper. That, of
Mm.
course, with the parents, we'll have to go deep down in the history, like how were the motor milestones, when did the child achieve, did the child achieve appropriate milestones. Apart from that, there'll be certain sensory processing questions too. Yeah. And
Mm.
handwriting, if we say, it's like, of course, it's the outer part. As I said, it's a motor output. But what are the
Mm.
layers which build on to the handwriting? So if we
Okay.
backstep, handwriting is not just, holding. One part
Like,
includes, definitely includes holding. Your grip
uh-huh.
and grasp does matter. That is one part, right? The other would be like, what is my core stability? Is that because of that, that my handwriting is affected? Is it because my shoulder stability is not strong enough? Is it
Okay.
because I am having some eye hand coordination? Is it because my visual perception is affected?
Okay.
Is it because my motor coordination is affected? Because many times, sometimes it may be seen that these are the children. Sorry, sorry. So
Yeah.
these are the children who also face certain other difficulties, certain hidden difficulties. So we go deep down, like what is it? Is it the attention? Sometimes their muscle tone is low, and they aren't able
Okay.
to sustain the strength to do the handwriting task. And handwriting
Okay.
is like it's a complex activity. So it not just involves holding, it becomes automatic after a certain stage. We also don't use our vision so much. Like we rely on our, what we say, kinesthetic memory. That's a memory in our joints. We hold the pen. We don't even have to look how we are holding at times. At times, even without looking, we can write because we have developed
Yeah.
that kinesthetic memory. So
Yeah.
with children, then we need to find out which is the area. Is it proximal, like central, or it is
Mm.
distal? Like even is a child aware of this individual finger positionings? Is a child
Okay.
having the touch sense? Is it appropriately developed? So these are few
Okay.
of the areas which we would really work on. The second part would
Okay.
be amongst the sensory is like your movement system also plays quite a bit of role. So many a times you
Mm.
find simple things, as you would have seen these children find difficulty from copying from the board, right?
Mm.
So
Mm.
copying from the board involves what? Like if you analyze the task, I have to look up, I have to then look down, I have to memorize. Like I
Uh-huh.
need good visual memory, I need good sequential memory to remember what's written. Also my
Mm.
perception, like amongst all the things that the teacher has written on the date, the thought for the day, and so
Uh,
many things on the board, I have to
uh,
focus on what's written on the board which I need to copy. Yeah. At the
mm.
same time I keep moving, so imagine when you're moving like this, your movement system is challenged. And if I'm
Yes.
sensitive to movement, it may make me feel giddy also. So you
Okay.
really need to look where is that trigger factor, or what is it which is really causing the difficulty. Now coming
Okay.
to handwriting, at a young age, yes, I would work at all this corrective patterns, yeah, wherein you work on developing the skills which are required for handwriting. After a certain age, maybe 12, 13, or beyond that, you look at coping strategies. So if the grip is inappropriate, with this inappropriate grip, how can I optimize the output of handwriting? Do I need to
Okay.
provide typing as an alternative, mode of writing for this child? Does this child need any additional support from the government in terms of concessions for writing? So that would be the
Okay.
later part, of course. But if it is identified earlier, then you can train the child in all these skills well in advance. So if I can give you a simple example about this, like I had a child who came to me with handwriting difficulties from one of our schools in Mumbai, and
Mm.
as we progressed, we did see certain amount of but what we realized is that when I spoke to the child, what were his what was his thought about what is coming in the way. So when we worked together, since the child was about 10 years, I could work on empowering him with strategies. So when he understood that he's getting anxious for handwriting, when he understood that he needs to change the posture, when he understood that okay, I this is expected out of me, what can be my coping strategy? So he he wanted to hold a stress ball in his other hand and just keep
Okay.
squeezing it when he was writing, and he realized it when he did that his
Okay.
performance of or completing his worksheets within the limited span of time was
Okay.
achieved. So we practiced that in the therapeutic setup, we practiced that at home, and then we spoke to the school to give permission to use this as a strategy and just try it out, and it
Okay.
did wonders. So just simple
Okay.
strategy which even the child could identify, when he could link with what is helping him and what is not helping him. So as an
Okay.
occupational therapist, when you see children even like working on themselves and being motivated to make that change and not be stuck with because they do hear a lot of negative comments because of
Yes. Yes.
handwriting.
Yeah.
So yeah, it does happen naturally. So we want
Yeah.
to go beyond that. So I would like to work with the child, not only the child, but of course the parent, and of course
Yeah.
the school setup. Everyone who is working with the child, because their self-esteem does matter. So that's
Yes.
how
Yes.
we go about for handwriting. And I've been trained in the level 1 of handwriting without tears, and I've personally seen a lot of differences when you combine even different sensory inputs or you work with a particular progression for handwriting.
Okay. So, Damayanti, I think in this case, no, the parents, the complete entire team has to be there. It's not the child and the therapist, right? Because,
True.
the example which you gave, it's a 10-year-old kid. So, the child is understanding that, he can do. But what about the smaller child, who is of just 5 or 6 years of age? Like the
Hmm.
example which I have seen,
Yes.
this first standard kid. Now the thing is, out of the 40 or 35 students in the class,
Hmm.
he's the only child who has problem. Rest all are fine. It's not that, but then that child gets, one is, parental pressure. Second is,
Yes.
all the teachers are not empathetic towards the child.
Hmm.
And the child himself understands that something is wrong with me. Okay,
Yes.
because I'm not like the other kid who is writing, whatever teacher is writing on the
Hmm.
board, they are copying. I am not able to copy, and ultimately my parents, they scold me, or they write something in the
Yeah.
diary and ask me to give it to the teacher. Now I have seen this kid struggling a lot, because
Yeah.
then in this case, I think teachers,
School.
parents, and
The
the
school.
complete entire school setup has to be very patient. So I think everybody needs to give that kind of push to the child, very patiently. Otherwise, this cannot happen, right?
True.
But in our country, do you feel like, especially wherein it's a, like, if you go to US or some other place, there is a
Hmm.
kind of people understand, in
Acceptance.
what
Yeah.
we feel is, in the group of 60, my child has to be, I mean, it's a kind of, जो कहते हैं ना, एक रेस में भागने वाला जो बच्चा होता है,
Ah.
that kind of thing. Every parent want that, but that is not possible. So somewhere I think parents also need to understand and be very patient and be very calm with the child, rather
Other
than
thing would be the acceptance. Like you need to accept
acceptance.
certain
Yes.
things and work
Yeah.
on it. It's not just like, okay, this is the difficulty, but there are ways to work on it, right? And
Yeah.
if you patiently work, see, even when you said a 6-year-old, like 4-year-old, 6-year-olds, when they see that this is helping them for something, right?
Yeah.
It's working
Yeah.
on them. They know that they can do certain things. They know that they have a choice in certain things. When they
Mm.
start getting small successes in, of course,
Uh,
like maybe a therapeutic environment, like
yeah.
clinical setup, or even at home, even those small progresses add a lot to the child's confidence. When
Mm.
it's externally supported with the school and the school environment, you will see
Yeah.
the change, because then the child
Yeah.
will be, if there is something like intrinsic motivation, when will this child have an intrinsic motivation, right? You can't just give motivating words, but the child needs to
Yeah.
experience the success.
Yeah.
When the child
Yes.
experiences the success,
Mm.
he is learning the way the child should learn.
Yeah.
So if I need certain modifications, if I need to strengthen certain things, if I know that I need to work on both hands together or whatever, crossing the midline, my eye-hand coordination. And if I'm focused on those tasks during the other time, of course, I'm going to see the progress.
Mm-hmm. Yeah, yeah. So
Yeah.
I mean, a lot of comments you are getting on the chat. So I mean, nice to see all these things. Like everybody's appreciating you. So we know that Dr. Damayanti is really a great person, and you know, this is. I mean, you can see after the session also there are so many
Thank
comments.
you.
I highlighted all the comments. Yeah. So
Uh,
that was Damayanti, a very nice, discussion on this particularly, because these are certain aspects which we hardly discuss on. People not know much about this. So this is, you have brought it into, completely you have explained, what is occupational therapy for the, even the geriatrics, which you said, it's something, a very different field. Maybe a lot of people do not know about this. So that's something, it was a very, lovely interaction with you. Nicely you have explained all the points, and I'm very thankful that you came on this platform, taking out time. And thank you so much, Damayanti. So before going, if you want to, I mean, before we end the session, would you like to give some kind of, suggestion or something to the parents? Yeah.
yeah, I mean, as I always say, like, when you're working and the moment you give birth to a child, we as parents, like when you become parents, you know how it is, right? So be aware about what is normal or what are the developmental milestones. If you there's something as an instinct as a parent, right? If you feel that something is not working for your child, do take the first step of approaching the doctors, the right set of people, and be
Hmm.
very very patient with your child. Whatever
Yeah.
set or whatever difficulty the child is facing is due to certain neurological process that the child is undergoing, right? So be very very patient, and you being calm matters a lot because your energies matter a lot.
Yeah.
So if you
Yeah.
are calm, if you are accepting and you're looking for solutions which is going to work for the child, you are also creating an environment which is very learning for the child. So
Yeah.
as a parent, I think acceptance, awareness, and being very very patient is really very important. So
Right. Right.
we all want to see our children growing, right? We want what is the ultimate aim? We want to see them happy and going to wherever whatever they want to do. But as a parent,
Yeah.
our role would be to be those catalysts to see them grow. So
Yeah.
even if there is some difficult situation, I think you just need to be strong enough and work towards a solution and work to creating the difference even in your child's life, because that matters. You are the first contact for the child. You are the first person the child would be comfortable with. And if you work with the child as closely along with your therapist and the team, you will see wonders.
Yeah. So thank you, Damayanti, for taking out time and coming here. Thank you so much.
It's
Yeah.
a pleasure, dear. Thank you.
Thank you.
Thank you,
Thank you.
everyone.
Thank you.
Thank you.